With just weeks until they reopen, the pandemic has drastically changed how schools will look. Join host Tim Seaman now for a live discussion with education and health officials on their plans and concerns for your child's safety. Coronavirus back to school.
And good evening again. Thanks for staying with us for this special town hall. And joining us, some folks from our community that have had their hand on the pulse of this situation for a long time. You know, back in March, tri-state governors shut down schools to prevent the spread of the coronavirus. And the education process moved from the school building back home to the classroom. Last week, seniors from Sioux City's 3 community high schools finally got the opportunity to celebrate graduation with an in-person ceremony, walking across the stage and receiving their diplomas, or at least turning their tassels. Now, after nearly 5 months of coronavirus in Siouxland, it's time for another class of seniors and students as young as kindergartners to resume the education process. But as COVID-19 continues to blanket the state, what does that return to learn look like? Well, to help us answer that question tonight and discuss issues that concern folks across our community, 3 folks, as I mentioned, that have had their hand on the pulse of this for not just a few weeks, but many months. Closest to me is Tyler Brock. He's the Deputy Director for Siouxland District Health. In the middle, Dr. Paul Gosman, who is the Superintendent of Sioux City's Community School District. And the far side, Dr. Terry Merle, who is the President at Western Iowa Tech Community College. And I want to start again by saying thank you to all 3 of you being with us.
Thank you.
I know a couple of you have joined us before. We really do appreciate your participation. Before we go any further, though, we do want to remind you that we want to hear what you're thinking tonight. So let us know if you've got a question or something that you'd like to have discussed about COVID-19. You can submit a question on Facebook. That's facebook.com/KCAU9News. And we'll try to have our experts answer those questions, give us the best case scenarios that they can. Now, we've seen a steady decrease in the number of illnesses related to COVID-19 here in our local community. Here's the latest update from Siouxland District Health out just from today. Just 9 additional COVID-19 cases confirmed in Woodbury County. That's out of 133 new individual tests. And that's the updated information. And we want to get started by taking a look inside those numbers just briefly with Tyler Brock. Do you still expect a second surge to come through Siouxland, Tyler, or is this middle stage of steady numbers that surge?
Well, I mean, we were certainly in a lot better place than we were a couple of months ago. You know, we had a massive amount of COVID come in all at once. We saw a nice decrease. We're probably up a little bit from where we were maybe a month ago or so. So I would, if it stayed right where it was for a while, I think we could live with that. But I would prefer that it go down. I would prefer that it go down further. We're still seeing plenty of virus activity that we've got to deal with, that we've got to try to manage. So again, we're in a lot better place. You know, severe infections are way down. Hospitals, the number of folks in the hospital are 1/5 of what they were, you know, during our peak. So severe infections are definitely way down, but case counts are still a little bit higher than what we'd prefer.
As we dive into this, we want to remind you that there really are no black and white answers to this. It's a gray area, and we continue to meander through that to try to find our way. But we do know one thing. The governors of all 3 tri-state communities have all said they want to see students back in school. Just today, the governor of South Dakota, Kristi Noem, saying that that was her preference, and she did that during a press conference. Earlier this week, both the governors of Iowa and Nebraska said the same thing. Here's what they said.
Students learn best when they're in school. For all of the wonders of online and distant learning, and it does play a role, it's not a replacement for in-person classes. We also can't forget the critical role that our schools play in addressing inequities for our most vulnerable student populations.
We know that, for example, that distance learning for some students is not going to be as effective, and so those students are going to do better in a classroom environment. So it's important from an academic standpoint that we get kids back in classrooms. But it's also important from a mental health aspect, right? Social isolation is not good for kids. We want to get kids back around their colleagues and do it in a safe way, but have them be able to get that social interaction is going to be important for kids. Also, it's part of you know, schools contribute to a healthy, physically active lifestyle. So getting kids back into school will help with that aspect too. And then, of course, nutrition. making sure kids are getting the nutrition they need.
Dr. Gosman, I know that those are some of your thoughts as well. Having students in a building with one-on-one attention is critical to their development. Just how difficult has this been? I know you've had plans. They've had to be changed because of proclamations. I know you have 3 different plans, really, the last that I was aware of at least, that could be put into play. So where are you tonight?
Yeah, so today we're still sitting on 3 different plans, kind of a traditional plan or an on-site plan, a virtual plan where all students would be learning virtually, and then a hybrid plan. And what we're trying to do is be responsive as customer service providers to our customers, our families, and noting that some of them are not comfortable or have medical reasons why they cannot be in schools. But that's not to say that just because a certain percentage can't be in schools, that we won't open the schools and that we don't want the others who can safely attend in person. We're certainly hopeful we'll be able to attend in person. Right now, about 20 to 25% of our students have registered for some sort of virtual learning, and so we know that will occur. Our decision likely won't be made until the week of August 10. And you're correct, we did have to alter our plan just slightly to adhere to the latest proclamation from the governor. Certainly not critical of her for doing that, but it caused us to just tweak our plan a little bit so that our hybrid model had enough in-person instruction.
And I think there's been some confusion in that vein, in that there were some that said, well, 50% has to be done in a school building. It has to be offered in a school building, as I understand.
That's the key right there. We have to deliver 50% in person for core instruction, but that doesn't mean any individual student has to receive their instruction by 50%. That really is a family choice and a choice of the parents and the student. And so, as I indicated, we've got about 20 to 25% of our students who will learn entirely virtually when we begin. I'm certainly, optimistic about what we heard from Tyler, and look forward to the fact that we seem to be managing our numbers right now. If we keep on the trend that we're moving toward right now, I suspect we could start in person, but we'll have to watch it very closely and be responsive as needed.
School districts like Sioux Cities, of course, have an expansive age bracket of students that they deal with each day. Dr. Merle, you have an adult population throughout. Have you faced some of those same difficult decisions and planning scenarios, or has it been easier because you do have adults?
I don't know if it's any easier. Certainly with adults, they have issues and concerns. Just like Paul had mentioned, we've tried a multifaceted approach in trying to offer classes. So we do plan on August 25th is when our classes start. We do plan on having classes on campus. We're seeing that our online enrollment is higher than it's traditionally been, so we are seeing people opt into online. Fortunately, we have that option already. And then our face-to-face courses, this year we're offering something different. We're calling them flex courses, in that every one of our face-to-face courses is going to have an online component to it, so that we would be ready to pivot if we needed to, but also knowing that a majority of our students who take face-to-face classes do so because they want that interaction. And they want someone there to be able to work with them, and they want to be in a social environment. So we're trying to offer the best that we can, all while trying to have the safest possible environment that we can have, not only for safe so our students are safe, but also safe so they feel safe, because I don't believe you can learn if you don't feel safe.
I was going to say, there's got to be a comfort level there. There's got to be a trust. That's something that we asked our viewers about earlier this week, was how comfortable are you in the process right now as we get set to head back into the classroom? Let's take a look at the first of our poll questions that our viewers did participate in, and comfortable in sending a kid back to school. And it's about 50-50, 52-48. But I was impressed that the yeses outnumbered the negatives in that. I would have maybe guessed that it could have been the opposite, but it is definitely split. Another thing that is certainly split, Tyler, is the use of face masks, whether it's in public, whether it's in business, whether it's in education. Specifically talk about education, and I know it's not a broad stroke, because you're talking about 6-year-olds that a mask is not a mask to them versus a junior in high school. So what would you say about the use of the mask? Obviously, it's an individual situation.
Yeah, the masks are are pretty decent at stopping some of those droplets. You know, whenever we're talking about the spread of COVID-19, we're talking about the droplets when we speak, when we cough, when we sneeze, those kinds of things. The masks do a pretty decent job of catching some of that. So they are a good idea, especially when distancing is very difficult, okay? And those are the kinds of situations that we encourage masking, and you know, whenever possible, regardless of the age, if people can safely do it, then it's a good idea, because trying to disrupt that transmission cycle in any way that's possible, again, especially in those circumstances where social distancing is difficult, those are the times when it has the opportunity to benefit us the most.
Before I have our administrators weigh in on that, I want to ask you one other thing. There's a lot of discussion out there that the data shows that students, children of school age are not good transmitters of this virus, and that they don't necessarily pick it up easily. Do you have a comment on that?
Well, I think there's something to that. Just about any statistics that you see anywhere in the world, the amount of infections in young people is low. And so, there is some data out there that shows that especially the youngest children aren't great spreaders of this virus. So there's more to learn about that. You know, there's nothing definitive, but I do think that we can have some confidence that young people, the people of school age, generally do not have serious infections. And again, there's more than just them to deal with. We've got staff and we've got their family members and things like that we have to address. But there is good news in the fact that kids generally don't have serious infections, and we'll take that.
On your campuses, do you have a firm plan at this point whether you'll ask face masks to be worn by your students or your educators, Terry?
At this point, we are requiring face masks. We do have students of all ages, and we do have ways to make exceptions for that, particularly students with disabilities or some kind of a condition that would make it very difficult for them to wear masks. But at this point, again, for everyone to feel safe and to not spread, we are requiring that. But that is one, I think, of a number of different things we're doing. Classrooms, I think a classroom that used to seat 30 students, now we've looked in it, when we've socially distanced it, it's 12. We're looking at any line that we would have for service, making sure that it's 6 foot distance on that. We do have plexiglass shields for most of our frontline staff members when they're working with students. So there's a number of different things that we have, and we're prepared as this pandemic goes on to be able to adjust that as needed. So we've started off probably a little bit more tighter than we would, because I found it's a lot easier to take away than it is to put more on.
Dr. Gosman, you've got kids, like I say, as 6 to 17.
Right. Yeah, we've got 15,000 students in the district in just about 25 different facilities. We've got, you know, hands-on courses versus, you know, traditional lecture delivery courses, you know, those sorts of things going on. We do know that part of our strategy is that a percentage of our students are going to be learning online. As I've shared already, you know, 20 to 25%, so that'll allow for a little bit more distancing right up front. But we do as well have the expectation that masks will be a part of the school day, and so every student will need a mask. Anyone entering the building will need a mask. All of our staff members will have masks. You know, we've bought sanitizer literally by the gallon, you know, so that it's available throughout the entirety of the district. And we're not only changing our distancing protocol, the way we serve lunch, the way we go to recess, the way we do certain courses, but also just the way in which we expect students to learn and handle their own workspace and then move on to the next area. There are some courses that we have, much like Terry's at Western Iowa Tech, such a great partner, that their courses are our courses in a lot of cases, like our career programs for high school students. Those are very hands-on, and you know, it's really difficult to learn that in a virtual environment. It would be very difficult. I'm a former band director. It would be very difficult to have marching band in a virtual environment. You know, so there are certain things we are going to have to find ways to work our way through. But yes, masks will be a part of our school day.
And are those things that students or teachers will be required to bring staff members, or is that something you might be able to provide through the CARES Act?
Yeah, a little bit of both. I mean, we are saying that we'd like everyone who's coming into the building, whether staff or student, to have their own mask, but we've provided our staff members with masks for when they return. We've purchased, as you might imagine, nearly 100,000 disposable masks to get started, and we'll see how long those last. We can get them quickly as we need to. So it's really been an interesting process. I should mention the CARES Act was wonderful, and it really did help us with a lot of these supplies. That money's been long gone for a period of weeks now.
Education, of course, the classroom activity is key in the education process. So is transportation. Getting your son or daughter to school each day can be a task without COVID-19. It's another of the things we asked our viewers in the Facebook poll. Let's take a look at the answers that they gave us in that. As far as you talk about the buses or extracurricular activities and the different ways that you need to get to the classroom. And our viewers said this, this is a question, I'm sorry, not one of our polling questions, but a question from Facebook tonight. How will busing work this school year? It's simple, right?
Yeah, simple.
No, I try to make a joke there because I know it's not.
I appreciate the question, and it's a challenging one. If we were to...
It's been a challenge this fall with the sports teams that you've had.
If we were to engage the actual original protocol for social distancing while children enter and leave the bus and while they ride the bus, we would only be able to transport 8 to 10 students at a time on a 72-passenger bus. So, you know, very obviously we're not going to be able to do that, which is why the other protocol are so important. I know that the wearing of a mask has become somewhat political to some people. It's certainly not to me, but we have to understand that there will be times where we've got to do everything we can not to just protect ourselves, but to protect those around us. And so if people feel that that's a measure that's a little further than it needs to be, I just ask them to consider there will be some things like that. We will not allow our students onto the buses unless they have a mask with them.
And masks is something we did ask our viewers in one of our pollings during this last week. Let's take a look at the results that we got from that. Should masks be required? And it's pretty much down the middle, a percentage point here or there. And that's the way I think you'd probably see the numbers on the street if you stopped at the hardware store or the bakery.
I think you're right, Tim. And I should say as well, with our transportation, we're trying to run more routes. We only own 65, 70 buses as it is, and so we didn't go out this summer and buy 100 more buses. We just simply can't do that, but we are trying to restructure the routes in a way to keep students as safe as we possibly can.
Terry, this probably isn't as specifically towards you, but both of our administrators. We hear in the summer about brain drain. Kids leave the classroom in the springtime and maintaining that education that they've learned. What have you learned so far about brain drain with the situation with the at-home learning? Do you expect to see a significant decline in students as they come back to the classroom? And I know you have an adult population, so
sure we do. I don't know that brain drain is as big of an issue in higher education. I think that the key is that we certainly encourage people to engage in a number of different things: reading, performing arts, sporting events. There's a number of different things that you can do that. So, we don't see that, as well as probably a third of our students take summer classes. So I think it's probably one that's going to affect Paul a little bit more, but I think the key that we're learning about learning is the more you learn, the better you get at learning. And so the more opportunities you can put learning in front of yourself, the better you're going to be, not only for the summer, but for the next academic year or for the rest of your life. So we certainly encourage that.
Yeah, at our level, we left school on March 13 and had no idea that day we would not be coming back the following Monday. That was a Friday, March 13. And I should have known it was Friday the 13th and something was going to happen. But we expected that the novel coronavirus would shut us down at some point, but not that quickly. And so at that time, we were not a one-to-one school district, meaning one child, one computer, everybody having their own device. We are now, because we've expended a great deal of funds to be able to shut down and go entirely virtual in every grade level. At that time in March, our middle school and high school students could do virtual learning. Elementary and early elementary, preschool could not. Now we've moved forward and we're going to be able to do more of that virtually. But if you look at it, by the time we get back to school, our summer will have been 6 months long. and very concerned about that. We start summer school in the Sioux City schools next week for grades 1, 2, 8, and high school mathematics. We pick certain grade levels to try and limit the numbers, and we also pick grade levels where the transition year was really important, that we finish what they were to have learned last spring so that we can get them learning again with the new products or new program of study this fall.
I want to ask you about the role of school nurses. They've been there forever. It's usually a gal you never see very often if you're lucky, but that's different today on both of your campuses. Dr. Gosman, will you employ more healthcare workers in your buildings?
Right. So right now we don't have additional school nurses, but we really value the nurses that we have. You know, we have 8 or 9 school nurses within the entirety of our district. You know, we've got strategies that we've put in place, like caring rooms for kids that have suspicion of some COVID symptoms, or they've been around someone who's immunocompromised or whatever it would be, and those won't always be staffed with nurses. But our nurses are our experts in handling this,
right,
and frankly every other health crisis that we see in all of these students.
Dr. Morrow?
Yeah, we're not going to be adding any more healthcare professionals, and we're probably, again, in a little bit different situation. You know, as Paul mentioned, they're a one-to-one school. We've been a one-to-one school for about 4 or 5 years. Every one of our students gets a MacBook. And so what we're doing, if you are not feeling well, you need to stay home. And we can deliver that education for you. Even if it's a face-to-face course, we can deliver that education to you at home. And you need to see your healthcare provider and follow those protocols. The biggest key for us is that if you're not feeling well, we don't want you coming in and potentially making someone else not feel well. So for us, I think it's better for them to do that work. We do contract with several different agencies that our students can use some of our funding to be able to do that. So we believe we're able to provide the funding for them to get health care, just not necessarily on our building.
And I would add to that our partnership has never been as strong with Siouxland District Health, our community health partners. We've always had a strong relationship, but we're really leaning on them far more often, calling there more often to say, okay, here's our situation. How do you recommend we manage this? And they've been very quick to respond and very thorough in their responses.
I would echo that from Paul's response. Yeah. We partner with them as well. They're fantastic.
You walked me right into the next question I had, Tyler. I'll get you back in the discussion.
I knew that. I was setting him up.
Contact tracing has become a cornerstone of tracing this activity and squelching it before it gets too broad.
Yeah.
What advice do you give to parents, to educators when it comes to contact tracing when you're dealing with a 7-year-old? He doesn't have any idea where he's been, and his teacher can't possibly be expected to know where Johnny has been during the day.
Right. It's going to be a little bit, it's going to be a challenge. There's no question about it that the school situations are going to be a challenge. I think that's one of the reasons why the various school districts and colleges have worked hard to implement distancing practices during the day. So if we do have a student, you know, maybe it's a situation where we can be pretty certain who that child sat by for a good portion of the day, you know, so that we can limit the disruptions. Maybe a whole classroom doesn't have to be home. Maybe it's just a small segment if someone is positive. So the key is that we will identify as cases get identified, we will investigate as to the best of our ability where, you know, what happened during the school day. A big part of this whole thing, and it's been, whether it's been athletics, whether it's been school situations, a lot of things happen outside of school activities, in home lives and social lives and things like that. And we're seeing a lot of that now, which is probably a bigger factor in the spread, and then the continuing ongoing cases seems to be more like what people are doing in their personal lives versus the activities they happen to be participating in, things like that. So it is going to be a challenge, there's no question about it. But if we can implement some of those distancing procedures during the school day, hopefully we can limit the impact of a case and that you know, so that we can limit the disruptions as much as possible.
Kind of go down that road here. We've got another question that was called into us this evening during our discussions. If a student or teacher tests positive for COVID-19, will the whole class be quarantined? And again, that's asking for a black and white answer, and we're not in a black and white world. But do you have what's a scenario that plays out?
Well, I mean, I'll start a second.
Sure,
and one thing that I'll say is that every situation is not going to be the same. And that is whether, no matter what, you know, you've seen things on the news, such and such is closed down because of a positive case. And then you'll see something else, something isn't closed down. They have had one positive case, but it's not closed down. So the situations are, you know, are all going to have their own nuances to them. And it is not a one-size-fits-all situation. We were hoping that entire classrooms do not have to be quarantined.
And that's certainly our hope as well. You know, we've got some classrooms, and we could even be in the same grade level, 4th grade. You know, there are 40 to 50 4th grade classrooms across the district. Not all of them are the same square footage. Not all of them allow for the same distancing. Not all of them have exactly the same number of kids. Some buildings will have one-way hallways at all times so that people are only transporting from one room to another in a one-way fashion. Some of our buildings don't architecturally handle that. We're able to do lunches in a different way. So my first thing, and I'm glad Tyler answered the question first, because my first thing is going to be to call Tyler and to say, okay, here's the scenario we have, and here I've learned to answer his questions before we even call him, which, you know, here are the kids who have been around that other student for 15 minutes or more, with or without a mask on, what kind of closeness and proximity was, so that we can give them as much detail as we possibly can, and then they help us figure out who to notify, who to quarantine, and what we can continue to move forward with.
I think it's important to remember that we're not trying to eliminate the risk, we're trying to mitigate the risk. This is one thing I read over and over from health professionals and others. Dr. Merle, on your campus, how would you handle that at this point?
It's going to be similar, I think, to what Paul had said. You know, the thing I have to let people know is I'm not a public health professional, and so we're going to rely very heavily on the professionals on that, make sure that we give them all the information that we have and have them help us in making that decision. I think a key for us, though, too, is to make sure that we notify students that there was someone, that there could be a potential danger, and then also let them work with their health professionals as well. A little stickier thing for us is we do have residence halls, and I know people have asked me what we're doing with our residence halls. We are going to have a limited capacity this year in our residence halls. We'll have no more than one person per bedroom, and we have a suite style dorms, and then we also have apartment style dorms, and then we'll have no more than 2 students share one restroom. So we're hoping that with all of that and the other things we have in place, that should help prevent a serious issue.
And again, as I said there, we can't eliminate the problem. We hope maybe a year from now we've eliminated it, at least for the time being. But to mitigate these issues is something folks need to remember. And hopefully people will show some grace and continue to partner with our educators,
something we're
our
constantly asking the
professionals.
public for is their patience and their grace, because none of us have been through this before either. Yeah. And we'll get it right, but it's going to take some tries. And we want to make that promise that we'll communicate, we'll be thorough, and we'll adjust as needed.
I've got to say thank you. We're out of time. I do appreciate all of you being here again. Be safe, be healthy, and we will continue to bring the very latest on COVID-19. Good night.